adults ages 18 to 64 in Denver, Colorado, for DEH Oral Health Promotion by Autumn Gibbons. Periodontal disease or gum disease is a very common disease in adults, not only in the US, but here specifically in Denver, Colorado. Nationally, the needs of adults living with periodontal disease have been well addressed in research, but there is little data here in Denver specifically. The need is known. The National Library of Medicine stated, quote, more than 42% of all adults over the age of 30 have some form of gum disease, and almost 8% of them have severe periodontal disease. Almost half of the adults are living with inflammation in their oral cavities. Despite the large number of adults living with it, University of Pennsylvania Dental Medicine explains how low the treatment rates are. Quote, the most alarming statistic of all is that most Americans don't even know that they have it. Only about 3% seek treatment for their gum disease. Since pain is a common motivator to get oral issues taken care of, the lack of pain associated with periodontal disease makes it so that many adults are unmotivated to treat it. In my experience as a dental hygienist here in Denver, Colorado, on average, 3 out of 8 patients I see a day have active or arrested periodontal disease. That is a significant portion of the patient population. There are so many factors that contribute to the chronic inflammatory condition. One factor that many adults experience is stress. According to the National Library of Medicine, quote, evidence from in vitro studies have suggested that levels of epinephrine, norepinephrine, and cortisol may directly influence growth patterns of single strains of periodontal-involved microorganisms. When we are living in incredibly stressful times, it is hard to escape these hormonal changes that come with stress. Another factor that contributes to the high number of periodontal disease cases is access to care and finances. I work at a practice here in Denver. Despite accepting the majority of dental insurance plans, including Medicaid, seeing firsthand the struggles patients face to get off of work for their appointments, make financial arrangements, and return for their future appointments has been very eye-opening. How it goes in my office is patients receive periodontal chartings or radiographs at every visit. After these records are obtained, a diagnosis is made. If periodontal disease is identified and non-surgical periodontal therapy is indicated, the patients will have to come back for another visit. Since they are now not in a state of health, insurance will likely not cover the entire cost. So patients then have to take more time off of work and pay. In financially challenging times, I have seen many patients how it is not feasible to do this. My office is open from 7 a.m. to 4 p.m. Monday through Thursday, so for many people that work Monday through Friday jobs, having access to care is challenging. But what solutions are available? Denver Health is a public health institution that serves many varying dental needs. They have a community health centers throughout the city and throughout the surrounding suburbs. They also have mobile healthcare centers and school-based healthcare center programs. This can help aid individuals gain better access to care and treat their periodontal disease. Education plays a major factor in helping people understand their oral health needs. Having this education in schools, starting children young, is the best way to start. Prevention is also a vital part of stopping the disease before it begins. So having this education in school and at every dental visit, also in hospitals and in assisted living communities, will be vital to ensure that there are less periodontal disease cases in Denver, Colorado, but also nationwide. Photos, I will be describing specifically what is seen in these images and how it relates to periodontal disease in adults. In this image here, there is significant bone loss pictured on this bite wing radiograph caused by periodontal disease. Similar thing in this anterior PA. This radiograph has significant bone loss on the anterior teeth, also caused by periodontal disease. This is a photograph taken of an intraoral mouth As you can see, the gums are very bulbous and inflamed, and this tooth that is missing was lost due to periodontal disease. This is an X-ray of the image that was previously shown. This tooth that is missing here, the bone wore away so much from periodontal disease that the tooth had to be extracted. This is another intraoral radiograph, a bite wing. In this image, you can see that the bone levels are a lot lower than they should be because of periodontal disease, and these spikes of subgingival calculus is causing this bone loss. Here's another intraoral radiographic image looking interproximally at the bone loss and then these spikes of calculus. This is another anterior periapical image showing the bone loss that is present due to periodontal disease. This image is looking at the lower right periapical premolar region. Due to these spikes of calculus and active periodontal disease, the bone levels have receded significantly. This is a periodontal probing chart taken, and as seen here, probe depths above 4, 5, and 6 indicate that there is active periodontal disease going on, and all throughout the mouth this is seen, so it's generalized periodontal disease. This is a case of severe periodontal disease. These lower anterior teeth were incredibly mobile due to the lack of bone support around them, and these bridges of calculus were acting like a crutch to hold these teeth in place. This is an image of that relates to the radiograph that was previously shown. You can see that these teeth are extruding out of the mouth due to periodontal disease. And then these are some upper teeth that have had such severe bone loss that the gum has started to recede, which exposes the root surface of the tooth below it. This is another image of severe periodontal disease that I saw in a patient. Due to the severe bone loss, again, the gums have receded so much and there's no support around these teeth holding them in there. And this is a similar situation due to that bone loss. The gums have started to recede away. This is a case, again, of severe periodontal disease. There's so much bone loss and lack of support from periodontal disease around this tooth. This is number 3, that the gum has receded so much. Again, here's another image of recessed gums due to lack of bone support underneath the gum tissue. This is a case of severe periodontal disease, an intraoral radiograph that shows that there is mobility on these upper anterior teeth due to periodontal disease. These lower anterior teeth have very little bone support around them from the periodontal pathogens. And finally, this intraoral bite wing of the left side shows the severe bone loss that is going on. This upper and lower teeth, they were both lost due to periodontal disease. These are all cases that I have seen firsthand in my dental office on adults ages 18 to 64, and it just proves how rampant this disease is and how many people that it affects.